On a Wednesday, right now, Chicago Public Schools and the Teachers Union are debating over whether to return to in-person learning. A new CDC report found that schools can be reopened safely. Dr. Robert Citrenberg, infectious disease expert at Advocate Aurora Health, is back with us. Doctor, good to see you this morning. How are you?
Good morning. I'm well. Thank you, Terrell.
Your key takeaway from that report, what is it?
Well, it was an interesting report, and I think it's been a little bit misinterpreted. What the report said from the CDC, there was a really good commentary that was published about it, is that schools can be reopened safely if the attention to all of your precautions is taken. So masks, good quality masks, social distancing, the ability to use hybrid learning where appropriate to reduce the number of kids there. And if all those measures are taken, schools can be open safely. They looked at studies from around the country and also from Europe that showed that there was actually lower rates of transmission in schools than there were in the general community. And that's really encouraging because we know the benefits that schools have. So it's something that can be done safely, but you have to have all the precautions in place, including limiting high-risk activities such as indoor athletics, particularly contact sports.
Dr. Citrenberg, the CDC report focused on schools in rural Wisconsin. Can those findings be applied to an urban school district with many, many students like Chicago's?
Well, Tanya, that was only one of the school districts that was studied. That report in Wisconsin was featured. And also remember that study was done in Wisconsin during a period of time last fall when there were sky-high rates of transmission in the community. And the rates of transmission in those schools was actually very low, much lower than the community. But they looked at school districts in other places around the country, including Mississippi, North Carolina, also looked at data from countries in Europe and found consistently that the rates of transmission in those areas was lower than the community. Now, can it be applied to all school districts? Not necessarily. The schools have to be able to provide those measures. They have to be able to provide distancing. They have to limit class sizes. They have to have masks available for the kids, and they also have to limit the high-risk activities. So that's something that does have to be at the individual discretion of school districts. But I think the point was it could be done even in the Chicago public schools if those precautions are taken.
Before we let you go, Doc, I want to talk about vaccines. Of course, you know, a lot of people are confused. I mean, it's turned into frustration in many cases with the rollout here locally. Any advice to someone trying to schedule their vaccination?
It's been very difficult. We've heard lots of challenges, technological challenges, people trying to schedule appointments that just disappear. They get their first shot, then they can't get their second shot anywhere. They have to drive 5 hours for an appointment. We've heard all the stories. What we're preaching again is patience. It's going to get better. The current administration has pledged to purchase many more vaccines. We have at least one more vaccine probably coming in the next month or so. The supply will increase. So it's going to get better. You know, after about at the current pace of vaccination, after about the next 6 weeks or so, it should get a lot better. The supply should increase, and the demand actually will probably start to peter off a little bit as well, too. So we're just preaching patience, and right now we're really emphasizing those people who are at most risk for the disease. Older people, sicker people are essential workers. We have to get all of them vaccinated, and then the general population will have an opportunity, hopefully within a couple of months.
All right, Dr. Robert Citrenberg, thank you so much, as always, for your time. Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.